Welcome to the video. So, anemia explained with Unani medicine. My name is Shifa Khan. I'm a naturopath specialized in Unani medicine, and I have a background in herbology, iridology, nutrition, and therapeutic massage. So, we're going to cover the who, what, where, when, why. It just gives a full spectrum understanding of the condition, the pathology, and it helps you retain the information as well when you follow that who it affects, what it is, where in the body, when is it likely to occur, and the why. Okay, so let's start with the what. So, what exactly is anemia? Anemia is a blood disorder, specifically a blood deficiency disorder. Uh, the word anemia is Greek in origin and it just simply means without blood. So quite easy to remember. And I like to look at the etymology because it helps break down the understanding even further. Okay. Anemia is very, very prevalent worldwide. Our statistics show, I think it was around 50% of all Indians having anemia, and that's just in India. It's prevalent throughout the world. So I consider it as a little bit of an epidemic. But what people forget to mention is that there are different types of anemia. So we have anemia that affects the shape of the red blood cells, and we have anemia that affects the count of the red blood cells. So when the shape is affected, meaning they have sort of an abnormal look to them, it's usually linked to a deficiency in the body. And when the count is reduced or there's not enough red blood cells circulating in the body, even if they are normal, then it usually links to a compound condition, some sort of chronic disease, inflammation, and or infection in the body. So I've got the scientific names for them. So we've got microcytic anemia, referring to the small red blood cells, usually from an iron deficiency, and we have a macrocytic anemia, usually from a B12 or a folate deficiency, and then we have normocytic anemia, and that's, as mentioned, chronic disease, inflammation, and infection. So that's what it is. Three types. Let's move on to the next, okay? So, oxygen is dispersed through the body, through the blood, and the vehicle or the transportation is through the red blood cells. So, when there is a decrease in red blood cells, you can imagine the supply is then sometimes discontinued in extreme circumstances or just slowed down significantly. And the number one thing in the body that is affected the most is then the circulation. So anemia is going to target or affect the whole body. Now, two organs that it affects the most is the heart. So because of the shortage in supply, the heart ends up pumping faster, pumping harder, just so that the blood can be sort of speeded up to work harder. Because imagine there's a factory and there's a shortage in the staff. The same amount of staff members are going to need to do the work of the others, and so they end up working a lot harder. So it's the same sort of scenario going on. And this brings me to the next point. Because of that increased heart rate that is typical amongst anemics, it can mirror or manifest symptoms like anxiety and even then depression. So anxiety, that increased heart rate can make individuals feel more anxious or stressed or need just flustered. And this can cause a lot of mental fatigue. It can cause feelings of anxiety that can put a downer because it affects their general well-being, thus mimicking signs of depression or feeling burnt out for no apparent reason. And that's just because there's a shortage in the supply of the red blood cells. And then secondly, the brain is also affected greatly, and that's because the brain is an organ in the body that depends on a high oxygen supply. And this is why anemic, one second. Um, as I was saying, this is why individuals with anemia experience a lot of the symptoms like headaches, mental fatigue, uh, foggy brain, or tiredness, or just slow, where they feel mentally quite slow. It's mirroring symptoms that are common to like being sleep deprived, you could say, and that's just because of the low supply of the red blood cells again. And then thirdly or fourthly, the breathing is heavily influenced, and this is again to do with poor circulation, and it can cause a lot of shallow breathing, and it can cause a lot of open mouth breathing as well. uh, then we have the muscles. So a lot of anemic individuals tend to feel tired quickly, and sometimes they can feel muscle soreness, much more than individuals who are not anemic, and that's just because their uh, wear and tear rate to is much faster, uh, and their ability to recover after exercise is much slower. And then lastly, complexion or skin texture, nails, just the general feeling of looking quote unquote beautiful is affected as well. And that's just because of the shortage in oxygen supply as well. The face can sort of lack luster, the hair can become quite dry, nails can become quite brittle. And these are all signs of being anemic. Now we've come to, when does anemia occur? So earlier we mentioned four things. So we've mentioned nutrient deficiencies, inflammation, infection, chronic disease, and there are a few more in instances where anemia can occur. But for the sake of the video and just for um, the sake of simplicity, I want you to remember two things. Anemia occurs when there is either an issue with the production or an issue with leakage. So when we're talking about the production, we're talking about whether or not the body is able to produce red blood cells, enough red blood cells, whether the body is able to produce the right type or right form of red blood cells. So that's the production area. And then when it comes to the leakage, if the body is losing more red blood cells than it can keep up with. So it's either a production issue or a leakage issue, and at times it can be both. But this, just for the sake of simplicity, you can group all the causes of anemia and when anemia occur into those two categories. And this now moves on to who is affected by anemia the most. So women are more affected than men, and that's because they have many periods in their life where blood loss is more pivotal. So the most obvious example would be during menstruation, but then also during pregnancy, their bodies require them to produce more red blood cells for the growth of the baby. And so I think the supply, or rather the demand for the red blood cells increases about 20 to 30%. And also post delivery, they can experience a lot of postpartum or postnatal bleeding. So women are more affected than men, but men can also be anemic, and we'll come to that again. It's usually an issue with the production rather than leakage. And then for children, again, because their digestive tracts are still forming, they can also have issues with the production just because of the digestive weaknesses. Okay, so we've covered the who, what, where, and when. Now it's the why. And we've kind of touched upon this throughout the video, but why does anemia occur? So when it comes to the production, issues with the production, these are the five factors that interfere with it or cause issues with the production of adequate red blood cells. So number one is super simple. It's the inadequate intake of nutrients. Foods that are not going to build red blood cells, you are what you eat. If you're not eating the right foods, your body won't be able to create them because it doesn't have the material to create them. And then there is inability to absorb the nutrients. So you might actually be eating the right thing. You might have the best diet in the world when it comes to building red blood cells, but there is a fundamental issue in your body, in the factory system, that is causing mishaps or delays or badly shaped cells. So either inadequate intake or the inability to absorb and break down the nutrients. And then again, we have pregnancy, when it's not, pregnancy doesn't itself cause anemia, but it's just a stage where anemia can occur more when the pregnancy is not being handled as well. And then fourthly, we have parasites that affect the production of anemia, and that's because parasites um, love to feed on iron. Iron is what creates red blood cells, and so if you've got an issue with parasites, and you're eating the best diet in the world, you end up feeding the parasites. They end up getting stronger, and the body becomes weaker. So again, issue with the production. And then lastly, there's a thing, or in Unani medicine, called stagnant blood. So stagnant blood is, how could you say, it's where, imagine you're trying to go from point A to B, but the gap in between is completely full, it's crowded, and so going from A to B becomes very, very difficult, and you end up slowing down, you end up giving up maybe halfway. And that's the uh, analogy of stagnant blood in the body. It sort of takes up space, and is to do with the body's detoxifying mechanisms being hindered and weakened. So when there is stagnant blood, this is sort of an old-fashioned or more classical way of saying toxins in the body. When they are far too much, taking too much space, the manufacture of new blood is hindered. It's the factory example as well. There's workers, they're just trying to do their job, but there's way too many people, there's boxes everywhere, their production then, or their productivity is affected. And this usually occurs and is linked to a liver issue, because the liver is according to Unani medicine, the factory in the body that creates the blood, the different components of the blood, and it's similar to Western medicine then. But it usually is a liver issue when there is an obstruction in the liver somewhere. So those are the factors relating to the production. And then when it comes to the leakage, we've mentioned heavy menstrual bleeding, we've mentioned postnatal bleeding, but then also bleeding from the gastrointestinal tract. And this is common cases where, for example, there is constipation, chronic constipation that forms very, very hard stool, and it can puncture the lining, causing bleeding there. But then again, other traumas, you could have injury, you can have traumas in like wounds that can cause a lot of blood loss. But I've just highlighted those two because those tend to be the most common types of why anemia occurs. So, from a functional medicine perspective, the treatment is very, very simple. It's all about feeding the body the right nutrients to form the right red blood cells to treat the anemic problem. So it's about fixing the supply chain. And there are a few key nutrients that it focuses on. So number one, and probably the most important, is iron. And iron has two forms. So there are the first is non-hemia iron, and the one of the richest forms of that is algae, seaweed, and microalgae, i.e., spirulina. And then there is the hemia iron, which comes from dairy and meat, not so much dairy, but more red meat. And the difference between these two is that the non-hemi iron tends to be a little bit harder for the body to absorb. So getting the iron from meat tends to work more quicker, especially organ meats like liver. Um, this is why anemia can be more prevalent in vegetarians and vegans. And I know it's very controversial because everybody has an opinion when it comes to nutrition, but those are sort of the quote unquote facts. But then other micronutrients that affect even the production of adequate red blood cells are, for example, vitamin B12, which we mentioned earlier. Without sufficient B12, the red blood cells tend to be too big, and so they don't function as they should. And this vitamin can be got taken or received from red meat, dairy, fish. And then we also have vitamin B9, which is also known as folate. And again, it can come from super greens, leafy greens, and chlorophyll rich foods. However, with this, it can be lost when those vegetables and foods are overcooked. So it's best to be taken steamed or sauteed or even raw. So a very good dinner, you could say, is something like steak with a side of steamed broccoli. Um, and then we have vitamin C. So vitamin C comes from citrus fruits mainly. It can come from certain vegetables and berries as well. And vitamin C supports the absorbability of iron. So it's very, very crucial for anemics. And then also we have copper, again, which helps with the absorbability, and that's usually from um, seafood and fish. And then we have vitamin A as well, that help with the formation and the absorbability. Vitamin A, like iron, has two types. So we have retinol and beta carotene. So the retinol is from the animal products, and the beta carotene is from the vegetables. Some examples are listed on the screen. Retinol is the more active form, and it is absorbed into the body much more easier. And so, in cases of quite severe anemia, I would say stick to the animal products if your body is able to digest them. Certain animal products can be harder to digest, so it's just about going through a case by case. So, just to recap, iron is what builds the blood. The vitamins, the B vitamins, it's what help form beautiful red blood cells. Vitamins C, A, and copper is what helps the body absorb and use it properly. Okay, so you can have a very, very balanced diet and still be deficient, like we said earlier, if there is other issues with the absorbability, and this usually comes from poor habits. For example, having things at the incorrect time. Caffeine should not be taken with your meals, and that's because it affects the absorbability of nutrients, specifically iron. So coffee, tea should be taken at least an hour after the meal. But and I would say this should have been at the top of the list because it's actually one of the major contributing factors in the occurrence of anemia, and that is stress. When your body is stressed, it's going to negate all the other functions in the body. It's going to forget about repairing the body. It's going to forget about digesting food properly. It's going to forget about relaxing because it's agitated, it's on the go, it's the blood sort of goes elsewhere. It usually goes to the feet so that it can help you run away from danger. So it's moving away from the digestive tract. And so what this does in a nutshell is that it reduces the hydrochloric acid in the stomach. The hydrochloric acid is what is going to break down the meats, the hard to digest foods. And over time, chronic stress has is can severely impact digestive function. So this leads to poor nutrient absorption, and it affects the production or causes the issue in the production that we referred to earlier. Okay, and then lastly, overeating as well. When you overeat, it's not that you're giving the body lots and lots of nutrients. If anything, you deplete the body of more nutrients because the body doesn't focus on getting the most out of them. It focuses on getting this mass amount of food out of the body because it's not healthy, and if anything, it produces more waste, it produces more toxin, it causes that obstructed liver or that stagnant blood that we talked about earlier. So the first is a scenario where there is excessive constipation, and because of the constipation there is low absorption because there is so much fecal matter. Sorry to be descriptive here, or vivid here, but because there's so much fecal matter in the intestines, the digestion is just super slow, and there is just a very heavy feeling, and the stool has become quite almost rock solid, and it's caused a tear or puncture in the intestinal lining, causing excessive bleeding. So what example or what issue do we see here? Okay, I'm going to tell you. It's an issue with the production and an issue with the leakage. Scenario 2. A woman has a very lovely, beautiful, healthy pregnancy, no issue with blood supply. However, there was a very traumatic delivery where she experienced significant bleeding, she had hemorrhage. And so here, it's not that there's an issue with the production, it's solely an issue with leakage of red blood cells. So now her treatment would be focusing on simply repairing or stopping the bleeding and replenishing her body. And thirdly, the scenario 3, the diet is mainly of meat and it lacks vegetables. So it's meat, there's a lot of iron in the diet, but it lacks vegetables, so there aren't adequate sources of the trace minerals that are also required for healthy red blood cell formation. And to top it off, they have tea or coffee straight after eating, which decreases the absorbability the absorbability of iron. So here it's an issue with production, there is no issue with leakage. So these three scenarios help to put everything that we've discussed so far into real life examples, because I'm sure there are people that can say, oh yeah, that is definitely me, and that's where my anemia came from. So we talked or lay down sort of the nutritional groundwork. So other treatments would be as follows. So of course, enhancing the diet, we've mentioned that in detail. So second, it would be remedying any digestive issues. So we touched upon low hydrochloric acid, so increasing hydrochloric acid, dealing with any parasite issues, any other digestive issues, for example, diarrhea, constipation, anything that would impact the absorbability of nutrients. In addition, there are sort of vitamin therapies also that are commonly used and recommended. Um, so we have vitamins B6 injections or taken in tablet form. Folic acid is a synthetic version of vitamin B6. I'm not a fan of them, but anyhow, and then we have IV drips, getting an IV drip of iron. Now, the last two relate to more chronic diseases. So, erythropoietin is a protein, is a hormone made from the kidney that basically tell the bone marrow how much red blood cells to produce. Re- Red blood cells are created from the bone marrow. When it comes to any kidney disease, especially kidney failure, that hormone is not being produced, and so the body doesn't know how much to produce, and so in cases of kidney disease, patients can easily become anemic that way. So, supplementing that with erythropoietin can be used therapeutically. And lastly, blood transfusions, and this is usually the case of quite dire or extreme cases. And usually for something called sickle cell disease, which is a disease relating to the bone marrow, where the bone marrow itself cannot create enough red blood cells, and this tends to be a genetic condition. Okay, now we are coming to the star of the show in this YouTube presentation on anemia and how it is treated. And the medicine way, Unani medicine perspective does not reject any of sort of the functional advices. If anything, the a functional approach is a very holistic, well-grounded approach. But for to critique it in one way, or to give it just one critique as a Unani practitioner, is that it does not target or it does not include the individual's temperament. Okay, and to explain that, I'm going to give a little bit of context as to what Unani medicine is. So, Unani medicine is Greek medicine, it's ancient Greek medicine. So, it's the foundation of functional medicine, it's actually the foundation of Western allopathic medicine. And it was the medicine that was taught in the universities throughout Europe, throughout the Middle East, and throughout the Indian subcontinent for centuries and centuries. Now it's practiced more in the Indian subcontinent because, and there's a whole history to that anyway. So it's really one of the most ancient forms of medical practice. And to explain the philosophy in the best way I can here is basically the Unani philosophy is that there are unique differences. So there are unique differences, and individuals to maintain a state of homeostasis or a sense of well-being is going to look differently from person to person. Okay, there are four main types of individuals, and this includes their behavior but also their physiology. Uh, these are called the four temperaments, and that's here on the screen. So in Unani medicine, there is this theory of the four temperaments, four different body constitutions. This impacts how the body functions. So for each four, the body is going to function slightly differently, but all are considered normal. All are considered healthy. It's sort of like looking into nature and seeing different types of trees. They are all trees. Different types of animals like cats or dogs, but they're all either cats or dogs. Same with individuals, same with human beings. And to simplify them, we categorize them into four. And the four temperaments, what makes them, or what how we categorize them, it depends on what the four humors. So the four humors are humor. This word here is a body fluid. So there are four main body fluids. Okay, and there is a different ratio of those humors. So, for example, one person might have more body fluid A, then someone might have more body fluid B, more of that fluid in their body. And so, depending on the fluid that they have the most, that's what creates the temperament. Okay, and so there are individual nuances, and I'm going to create a separate video to explain this a little bit further, just because to a Western mind, you could say, or a mind that's not familiar with the Unani framework, this can become a little bit difficult to understand. But anyhow, some physical bodies are more hot, some are more cold, some are more moist, and some are more dry. So some people have more dry skin, some people have more moist skin, some people are more faster, they just react much more quicker, some people are just slower, and these are all normal. We're not all created the same. Okay, and when so we all have a natural temperament, so we all fit into one of these four categories. So if a naturally hot person becomes cold, for them that's an abnormality, that's a deviation, and because of that they're going to become ill. So, healing the whole body for our Unani practitioner is to bring the individual back to their healthy temperament, their original temperament, because these temperaments are what we are born with and will stay with us throughout our entire life. Okay, so when the temperament shifts, that's when the diseases occur. Okay, in case of anemia is when the blood becomes too cold or the blood becomes too hot, and then again it can become too moist, it can become too dry. And so someone who is naturally a certain temperament, again, if they are more hot, they are more dry, which is a choleric individual, becomes more cold, more moist, they switch to becoming phlegmatic. Their body is going to experience symptoms of disease. Okay, bear with me if this was a little bit hard to understand. Okay, so examples. Ginger is excellent. It is very, very good for the digestion. It's an adaptogen, it's anti-inflammatory. It helps ease spasms. It's really good for menstrual cramps. It's so amazing. It helps improve circulation. and it's a natural treatment for anemia. Yeah, it can definitely. But for everyone, that's the question. That's the foundation to Unani medicine. Having understanding it might not be for everyone, because we know the bodies are built differently. So one thing might be a sense, a remedy for one person, it might be a source of dis-ease for another person. Okay, just bear with me. Another example, steak is very, very high in iron. If you're anemic, eat steak. Okay, we don't reject steak is high in iron. It can be a very nourishing food. But bear with me, let's delve into that. So IBS can cause anemia. IBS can interfere with the absorption of nutrients. IBS is part of the production issue. Okay, that issues with production. IBS, an example, it's a gut issue, it's a chronic disease that can interfere with the iron, with the absorption of the nutrients from food and the production of the healthy red blood cells. Okay, now we have an example of Cora the choleric. She has IBS. She's 32-year old, she's a woman, and her natural temperament is very hot and it's very dry. So that's her natural temperament. When she is hot and when she is dry, she is in a perfect state of health. Cora also has a long-standing illness with IBS, and she predominantly diarrhea type IBS, where she has profusive diarrhea multiple times a day. Her lifestyle is a major factor into her IBS because it's full of high stress, irregular eating habits, and lots of spicy food. All these things create excess heat in her body. She already has heat in her body naturally. Anything excessive or producing lots of heat is going to just tip the scale. Okay, because of that, there's a lot of heat, a lot of inflammation now in the body because she's doing things that are making her body more hot. She has developed IBS and from that gained anemia because due to the diarrhea, she's not absorbing any of the nutrients. So the Unani treatment would be to give her something astringent first. Astringent to stop the diarrhea. Something that is stringent thing, so to collate the liquid, stop it from flowing so much. So things like pomegranate juice, which is a very good astringent, natural astringent, or a herbal formulation, a Unani one called Sherbet Ahmed Shahi. This is a very profound astringent medication or formulation in Unani medicine. This would stop the diarrhea. Then, second to that, she would be given something that is slow digesting. Her diet would change from eating slow digesting foods like khichdi, legumes, steamed vegetables, and this would help slow things down and cool things down. And then to supplement this further, she would be given cooling drinks like yogurt drinks, iron, or shumli. And this would help balance her digestive issues. Once her internal system becomes cooler and her digestion then becomes stronger, she might not need any iron supplements because the iron levels in her body would restore by themselves. So from a Unani perspective, we didn't really target the anemia per se. We simply targeted bring her temperamental dis ease, the abnormality. We cooled her down. Okay, so another example, we have Philomena the phlegmatic. The phlegmatic body type is someone who is naturally cold and moist, and for her case, she's become excessively cold and moist, and this is because majority of her life is sedentary, and she has a lot of cold foods. The type of foods you eat will impact your temperament in Unani medicine. If you're eating cold foods, your body will become cold. If you're eating heating foods, your body will become heating. So if you're already cold, you need to eat more heating foods to stop it from becoming excessive. Okay, to maintain a balance. And so her treatment was to eat, and because she has constipation type IBS, her treatment was to eat soft, easy to digest meat stews, which are very nourishing, which are warming, and increase and take that with psyllium husk. Psyllium husk adds fiber and helps soften the stool to so that it can pass easier. And then for her, it was the adding of ginger or cayenne pepper, a short course, approximately 10 days. This would increase her digestive fire, bringing heat into her digestive system. And from a more Western perspective, this is what increases the hydrochloric acid. And then a must was for her would be to walk in the morning and the evening. Again, this is to help stimulate the peristalsis, um, and to increase blood flow to her digestive tract to help with the constipation. As you can see, these are all heating things. And then dates with milk, and then maybe a Galen's formula, which is also brings warmth to the body. Okay, now going back to these, imagine giving ginger to Cora. Ginger is a heating herb. If we gave her ginger, this would increase the heat and make her diarrhea even worse, because her her symptoms were already to do with excess heat, so adding more heat to her would be detrimental. And then imagine if we gave steak to Philomena. Philomena, she already has digestive weakness. She gets chronically constipated all the time. Steak is a food that is very hard to digest. Her digestive system is too cold. It doesn't have the fire to break that down. So for her, having meat stews, that's what she would need. Yes, that getting the iron is not where it's about getting iron from the food she's eating, but in a more easy to digest form. So the Unani protocols are very simple. it's it's it aligns very, very closely with functional medicine. We do not negate anything from functional medicine. However, we include the digestion, we include the temperament in our treatment, because it makes the treatment more on target. It makes it more effective, because yes, both of these two are correct. They're correct on surface level, but when we don't have the understanding of temperament, it can be errorous for that case. Okay, so with that being said, I hope this video explained anemia from a holistic perspective. You targeted what anemia is, what anemia, how it develops, the causes, the who, what, where, when, and why. We gave a in-depth functional medicine perspective on that, and we also gave the Unani perspective towards the end, to help bring everything from a functional level up a notch by including temperamental awareness when it comes to treatments. So if you found this beneficial, please let me know in the comments below, and I hope to see you in the next one. Thank you.